healthcare system is broken down in three areas, and it's called the continuum of care. You've got the hospitals, the physicians, your home physician, as well as long-term care and continuum care. So EHR is going to apply across all three areas of healthcare delivery.
There are two great challenges in trying to move to electronic health information systems from a provider standpoint. The first is money. Where does the money come from? How much would it cost? What kind of system are you going to use? The second is culture. It's fundamentally different for workflow. It requires learning new things, having new habits, and so people have both very great skepticism about where does the money come from, but they have equally great skepticism, how will it change my life and how will I have to do things differently?
The timeline nationally is probably 2015. The timeline for some provinces will be sooner than that. Some of the smaller provinces are more proactive. Province like Ontario maybe 2015 or a little bit later. So it really varies across the country in terms of province by province.
The creation of information systems that are electronic communication systems is absolutely inevitable. The only question is how long it takes and how much effort it takes. It's inevitable. It would be like asking how many ambulances are left in Canada that are horse-drawn. Well, I mean, one morning the last horse-drawn ambulance was replaced by a truck that was reshaped to be an ambulance, and the doctor who loved his horse got over it. Okay? The same thing's going to happen here.
On the onslaught of information technology, the model of healthcare delivery will change radically over the time. So the idea of your physician meeting with 10 people in a given day, or maybe 20 or 50 at 10 or 15-minute increments will change. In fact, he or she, as your doctor, will deal a lot with your medical issues online on a web-based methodology. So the delivery will change over several years.
Healthcare system, in large measure, maybe exceptions in this room, I haven't run into any. They don't measure customer service in this country. And the answer, when I ask them, is why? There's no place else to go. So why would we care, if I could use that word, about the customer experience, because there's nowhere else they can go? Well, that, with respect, doesn't cut it. I was on the board of another private sector company, UPS. We carry 2% of the world's GDP, and our supply chain at any given moment in time. And yet, if you ask us where your package was, we can tell you what street corner it is, what house it's on at any point in time. With track and trace technologies, with handheld computers, we know exactly where everything is in the healthcare system. The same week I saw this in Atlanta and then Louisville, we lost a patient in a corridor in Canada. Didn't know where they were. And, you know, things like that can happen. So it's not to denigrate the healthcare system, just to say we don't have the same tools of management that the private sector have, and we would be better than we are.
So from the IT side, the biggest challenge is actually resources, both people and financial resources. And for instance, here in the government of Ontario, they're going to expand something in the order of $2.4 billion on eHealth over the next few years, which is absolutely wonderful. But as a vertical market, healthcare has been spending 50% less than most other vertical markets. So it's been under-investing in information technology, and that radically has to change, or cost and efficiencies won't be improved.
The people who work in it are heroic, but they don't have the same set of tools. Just to give you a little example, we spend in our bank 10 to 12% of our budget, which is huge. I think our expenditure base is 8 to 10 billion in expenses. We spend 10 to 12% of that on information technology. And when you go to an ATM machine, you want to know exactly what your bank balance is. You want to get your money out, all of those things. All of that's got to be supported by information technology. In Canada, in our healthcare system, we spend 1.5% of our money on information technology. So how could you have the same tools?
There's a $17 billion difference between where we are today and where we were in December. And I can tell you that has certainly changed, and I expect ICW has seen, that has changed the level of interest in hospitals and doctors across America in a fairly significant way.
Studies have been done in both Ontario and British Columbia indicating that in the range of 2015 2017, which isn't that very far away, healthcare will consume 70% of the provincial budgets. Obviously, that's intolerable, but that is what we're facing with the demographic shift.
It comes down to fundamentally this. If I had a heart condition and I have a heart attack in Vancouver and I'm from Ottawa, the people in Vancouver will be able to bring up my EHR record, my eHealth health record and be able to deal with me in a very short period of time. Without that, they don't know how to treat me. And so it's very critical that we have that kind of record accessible to the clinicians.